Congressman Manzullo, this question is directed towards you. Over the past several weeks, we have seen rigorous debate regarding health care reform all across the country. The debate now seems to have shifted from a single-payer system to what is being called a public option. Can you please help us understand any differences between these two proposed concepts?
Well, first of all, thank you for the opportunity to be here. Second of all, I want to introduce my beautiful bride, Frida. You want to stand up, sweetheart? Give me a big It's a real joy to see everybody excited in America to be centered upon something that is so critical as the delivery of health care services. And the rigorous debate continues. I think this is our 11th or 12th open forum in the past couple of weeks that we've been traveling around our congressional district. I want you to know that I'm here. I'm not hiding. That many of my colleagues, that many of my colleagues are in full retreat because they're afraid to face the people that they represent. And that's extremely important because as a representative of the people of the 16th Congressional District, it is my job to be with you in all types of weather and all types of debate, and I'm here tonight to continue to serve you. Thank you for showing up. There is no difference between the single-payer system and the so-called public option. The health care bill that was introduced This bill was introduced on July 14th with the instructions that the President have it in a signable form on his desk before we broke for the August summer work recess. It's 1,018 pages. And as the person reads through it, and I've read through it all, I've studied it with the eye of an attorney for over 80 hours on about 60% of the bill. The bill is designed so that no private health insurance company can succeed. It's absolutely impossible. Let me just give you a couple of examples. A private individual health care plan is grandfathered. Cannot add any new enrollees. Whenever a public option is offered, which it has to be, an employee is automatically enrolled in the public option because that's the lowest employee cost plan that he can get. So how can employers keep more than one type of policy of insurance or program if his new enrollees, his new employees go into the public option plan as a matter of law? The third thing is that the different requirements say that you can't make any profit. It says very clearly that an insurance company that participates in the health exchange has to remit back to the insured the difference between the actual premium taken in and the cost paid out. So if private companies cannot compete, then that means that everything defaults to the public option. The public option rate of pay is Medicare plus 5% for the first 3 years. Now you can talk to any physician, any hospital. You cannot possibly pay your bills on that rate. In addition, if a person or a family is under 133% of the federal poverty level, which is about $20,000, those folks automatically are enrolled in Medicaid, whose rates are even lower than Medicare. So therefore, we'll end up with a system of insurance of Medicare and Medicaid for all. It will collapse the system. It will make it impossible for doctors and hospitals to meet their bills. And besides that, do you know who's not covered in this bill? Congress. You bet. Members of Congress, and 4 million federal employees. And when this bill came out of the Energy and Commerce Committee, with Henry Waxman as the chairman, Republican Congressman Roy Blunt from Missouri introduced an amendment that says that the President, the Vice President, and members of Congress are covered under the public option. All the Democrats voted no, all the Republicans voted yes. I will not vote for a bill unless it applies to me and the rest of the 4 million workers who are insured by the